Hello everyone. In today's video, I'm going to talk about liver cirrhosis, the key warning signs. Do not ignore these red flags in chronic liver disease or if you have fatty liver. What is liver cirrhosis? So imagine your liver, flexible, soft, and developing tough scar tissue. The scarring doesn't happen overnight. It's the result of continuous long-term damage. When the scar tissue worsens, it's not functional and it disrupts the liver's vital functions. But why is the liver important? To understand the severity of cirrhosis, we need to understand and appreciate what the liver does, essentially. It's one of the hardest working organs in your body. Think of it as your body's main filter, a protein factory, a digestive aid, and a sugar storage unit all in one. When cirrhosis happens, all of these functions are compromised. The silent progression of liver disease. One of the most dangerous aspects of liver disease is it's silent in nature. You can be losing liver function for years without any noticeable symptoms. That's why it's called a silent killer. The red flags we're going to discuss today typically only appear once the damage is severe. We don't want this to occur. Red flag number 1, persistent fatigue. This isn't just about feeling a bit tired after a long day. It's a profound sense of exhaustion that doesn't get better with any sleep or restfulness. This happens because the damaged liver can't efficiently store and release energy in the form of glucose from the body. Red flag number 2. Jordan, this is one of the most well-known signs of liver problems. It's the yellowing of the skin and the whites of the eyes. This is due to a substance called bilirubin building up in the blood. A healthy liver would process and get rid of it. Jaundice is a serious sign that the liver is struggling. Red flag number 3, abdominal swelling is something we call as ascites. This is a condition when the fluid accumulates within the abdominal cavity. It can start to cause significant discomfort, a feeling of fullness, and even shortness of breath. Ascites occurs because the scarred liver can't produce enough of a certain protein called albumin, which helps to keep the fluid within the blood vessels. Red flag number 4, swelling in the legs and the ankles. Similar to the swelling in your abdomen, you might notice swelling in your legs and ankles and feet. This is called edema. The same mechanism that causes ascites starts to play a role here as well, and it's due to a lack of protein in the bloodstream, leading to the fluid leaking around into the surrounding tissues. Red flag number 5, easy bruising and bleeding. If you find yourself bruising very easily or bleeding more than usual from small cuts, it could be a sign of liver trouble. Your liver produces the proteins necessary to help your blood clot. When it's damaged, you can't make enough of these clotting factors, leading to these symptoms occurring. Red flag number 6, itchy skin, known as pruritus. Persistent intense itching without an obvious cause is another red flag. This condition, known as pruritus, is thought to be caused by the deposition of bile products in the skin that can be damaged when the liver no longer processes them properly. Number 7, hepatic encephalopathy. This is confusion. This is a very serious symptom. When the liver can't filter out the toxins from the blood, these toxins now travel across the blood-brain barrier and start to affect its function. This is called hepatic encephalopathy, and it can manifest as simple as forgetfulness, but can also cause balance issues, changes in gait pattern, changes in walking, confusion, and some personality changes as well. It also leads to constipation and other changes within your GI symptoms. Red flag number 8, nausea and loss of appetite. Feeling constantly nauseous and losing your appetite are also common in liver disease. This can be due to a combination of factors, including the buildup of toxins and the liver's diminished role in digestion. This can lead to unintentional weight loss, and this is when we start to see that buildup of muscle loss, sarcopenia, and frailty. Don't ignore these signs, and if you're concerned, please flag with a medical professional and go see your doctor as soon as possible. My final point is a lot of these factors can be impacted by nutrition. So once you've been diagnosed and seen by a consultant, make sure you are also referred to a dietitian, because if you're not getting the right amount of nutrition, these symptoms will get worse. Thank you for listening. Hope you found that presentation useful.